Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Anita Valens. How are you today?
I'm great. How are you?
I'm living it up.
Yay. Living it up is a phrase that we would like all of our listeners and callers to be able to say every day, right? So,
absolutely. You can say it.
Yes, you can. But if you're in chronic musculoskeletal pain, or basically orthopedic pain, you might find that a bit difficult. That's why you're going to call this program today. Soon, so we don't run out of time for you. It's only an hour program, so write this number down, 866-870-5752, 866-870-5752, right here in the studio, and you can speak directly to Dr. Darrow regarding your muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee pain, hip pain, arthritis pain. Maybe you have stiff joints or dull aches. You don't know the origin of it. That's okay. You don't have to know what's going on. You can call, and maybe Dr. Darrow can help you figure it out. When you call the program today, you also get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Very important byline there. 264 scientific studies are contained in this book, and the foreword is written by Suzanne Summers, the lovely actor. And we are here Saturdays at 10 a.m., again at 1 p.m. And please go check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. What do you think?
Well, I have a question for you. Are you ready?
Ready.
How did the dead brother and his dead brother resemble each other?
They were both...
They were dead ringers.
Oh, my God.
You don't get it. You don't get it.
I never get your jokes, but I'm learning. It's good. It's a good thing. And everybody's laughing at me, and that's a good thing, too.
Okay, here's one you'll get. If
yeah.
athletes, because this is a show about athletes, right?
Yeah.
If they get athlete's foot, what do elves get?
They get...
mistletoes.
Oh, God. That's a really good one.
I love hearing you laugh. I do these jokes really just to hear you laugh.
Well, I am always ready to laugh, because if you don't have a sense of humor about life or your pain, I know pain is difficult, but you got to laugh at some point about it. You do.
Okay, can I do one more joke?
Yes, one more only.
Why do bees have sticky hair?
I didn't know they did.
They do, because they use honeycombs.
Oh, of course. Oh, my God. Okay. Honeycombs. Got it.
I could just do this for the whole show until we get some callers.
I know.
And about callers, be sure to call in now, because once we get going, you're going to call in later, and we're going to be jammed. So I'd love to get you to call in now. And the phone number to the studio where you can talk to us right now is 866-870-5752. I'll repeat it for you, grabbing your pens or people driving. And if you're driving, it's a good idea, pull off to the side of the road, take off your Bluetooth so we can hear you. We don't mind if you yell at us, we just want to hear you. So again, the phone number is 866-870-5752. And for those of you that are a little shy to call in, you can call my office, and there's people there right now. 800-300-9300. That's easy enough. 800-300-9300. So what I'd like to do is go to, we've done enough jokes, right?
I think, yeah, we can do some more later if you like, but we can
Thanks.
move on from that.
Thanks, Mom.
So,
All right, so here's a guy trying to avoid a knee replacement. Let me see what he's got to say.
okay.
Yeah, that's a big deal. A lot of knee replacements being done today. Hello, my name is, I won't say your name, and both knees are diagnosed with bad problems. They say I need 2 knee replacements. The first one is July 14, and the second one will be after that. Today I heard about you, so please help me to get a better way. I want to walk again. I want to live, so please consult with information about what you do and how I can sign up for stem cell procedures. My email is blah, blah, blah. My phone is blah, blah, blah. Thank you, Dr. Darrow. I love you. Oh, I like that. It starts my day the right way, right?
But he's not getting a joke. Are you going to write him a joke?
It's actually a lady. Yeah,
Oh.
Ladies get knee replacements too. So what is a knee replacement? A knee replacement is where you actually amputate the bottom of the femur bone, the thigh bone, and amputate the top of the tibia bone, the leg bone, and you put metal in there, and then you have what's called a prosthesis. The problem with that is I get way too many new patients who come in who've had knee replacements where it didn't work out too well for them. I did have one patient who died from the procedure, had a blood clot to his brain. So surgery is a great thing when you need it, but when you don't need it, it's not a great thing. And there's way too many side effects that I see in my office. Albeit, I understand people come to me after they have a failed surgery, because I don't do surgery, and they want to fix what the surgeon wasn't able to. Not the surgeon's fault, and I say this every time I talk about surgeons. I love you guys. You do the hardest work there is in medicine. It has the most side effects. It's the most invasive, obviously. But it's not a good thing for people to get surgery unless it's absolutely necessary. If you break a bone, yeah, you better get surgery if it's sticking out of your leg or your arm or something like that. But I would say probably 99% of the surgeries being done for meniscal tears, ACL ruptures, rotator cuff tears, things of that nature, neck and back surgeries, in my humble opinion, should never have been done in the first place. And we've had people call up throughout the years. Nita, you've heard this. For you long-time listeners, you've heard people call up and go, yep, I had the surgery, it made me worse. And then you hear people call up all the time and go, I was told I had to have the surgery, I didn't do it, and I'm better anyway. So surgery is invasive. Stay away from it if you can help it. Most people that come into my office who are ready for a knee replacement or any kind of a musculoskeletal surgery don't need to get it. And I examine them. I look with an ultrasound sometimes to see what's going on inside the joint or whatever area it is. And I start laughing and I go, you don't need a surgery at all. And they're confused. People get confused because the surgeon put their MRI or CT scan or their X-ray up on the light board on the wall and showed them, or put it on a computer on a disk, and showed them what's wrong with them. But the problem is, as we all know by now listening to me, that you cannot diagnose someone's pain. You can't decide if they have pain based on an MRI or an X-ray. You have to examine the person. Unfortunately, most of the people who have had a failed surgery come to me will tell me that their surgeon never even examined them. They looked at a film to decide if they needed it. And we know this, that if you have a film that looks terrible, you may not have any pain. There's experiments done like this, studies done. And you may have an X-ray or an MRI that looks perfect and have terrible pain. So there's no rhyme or reason to connecting your film with your actual pain level if you have any pain at all. So be careful. I would say go to a doctor who does regenerative medicine. That means guys like me who do PRP, that's platelet-rich plasma, which is a procedure where we draw your blood from your arm and we spin it in a centrifuge, and then we take out the platelets. We throw away the red cells because they can irritate the tissue, especially if it's in a knee, because there's synovial tissue around the knee that can blow up. It produces fluid. And then the other way we do it is by using your bone marrow. And bone marrow has platelets in it also, just like regular blood does. And it also has stem cells and exosomes and cytokines and growth factors and all kinds of wonderful things. So please, 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 if you're thinking of a surgery, if your surgeon says you need one, get a second opinion. Don't go to a surgeon to get the second opinion because you get the same opinion. You go to a doctor who does something different, a different way. And this kind of work that I'm doing has been going on for more than a century. It's been used since the early 1900s by, I think there were doctors of osteopathy back then that were doing it. And then we had a couple of doctors in Chicago, Gus Hemwall and another one of his buddies, that were doing this for people that had neck and back pain specifically, and getting them much, much, much better without surgery. And I've picked up that line of work. I've been doing it over 20 years. I have amazing success. It's not going to work on everybody. I don't think it's a panacea for everything, but it sure makes sense to come into the office, get a couple of injections, and walk out without really any side effects other than you get a little bit stiff. A lot simpler than going into the hospital having a surgery where terrible things can happen. I've seen the worst of it all. I trained in surgery, in orthopedic surgery. I ended up not doing it because of my own shoulder surgery that my boss did on me that really jacked up my shoulder and made it terrible. I never blamed him for it. It's just kind of what happens sometimes. And then I was lucky enough to have discovered what was called prolotherapy back in the day, and meaning proliferative, or therapy that stimulates tissue to grow. And my shoulder healed overnight, and I injected it myself, if you can believe that. I had the guts to try it out, and I'd been to a seminar where someone had another doctor injected my wrist, which was 50% better overnight, and then it was time to tackle my shoulder, so I did it myself. And it's really kind of a funny story because my wife was watching TV, and I hopped into bed with her to watch TV, and I pulled out my syringe. You know the story, Nita.
Yes.
And she started yelling expletives at me, like, what the do you think you're doing? And I said, I'm trying this out. It worked on my wrist, and I'm going to try it on my shoulder. And she said, you're going to do it to yourself? And I was like, yeah, I trust myself. And so I did it, and I woke up the next morning. This shoulder had been bothering me for years. I had surgery on it, and I woke up in the morning, had complete full range of motion and zero pain. And at that point, I started doing it on my patients, begging them, saying, can I please try this type of therapy on you? And they were all like, well, I guess so, because I don't want surgery. And I've had very good luck over all these plus 20 years. And it's an amazing lifestyle for me. They say I'm the busiest guy in the world doing it. I'm not sure if that's true, but I am very busy. And I have, if you want to go to my Yelp reviews, yelp.com, look up Marc Darrow, MD, and you'll see what people have to say about me. You can look at it right now. Not everybody loves me, but most people do. There's always going to be some complainers, and it's unfortunate with Yelp. I'm not able to respond what's really going on because of HIPAA, which is a privacy of patients. They can yell at me, but I can't yell back. So a lot of that stuff that's on there is really just a disgruntled person who's crabby or something else, and they take it out on me. And doctors get sometimes the worst reviews when they don't deserve it. But I think you'll see there's enough amazing reviews about people having succeeded and healed up with regenerative medicine of platelets and stem cells. I think that's a good read. I don't know if you've ever looked at it, Nita.
Long time ago.
Do me a favor. Take a look at it just under yelp.com. Put in Marc Darrow, MD, and see what you think. And I want to get your feedback. I answer all of the reviews that didn't come out the way I want, but I can't really answer them with what I remember happening in that room with that patient, because it's an invasion of privacy for me to say that. Very
Right.
unfair system. Yelp is making mega millions because it's something like social media where people just like to watch and hear bad things. But for the most part, I'm doing pretty good. I think, last time I looked, I had over 150 very good reviews.
Well, if you're inspired by Dr. Darrow shooting his own shoulder and recovering, and you want to find out more about this for your own pain or that of a relative, a friend, do give us a call right now at 866-870-5752. That's 866-870-5752. Right here in the studio, you can talk with Dr. Darrow and see what's going on with your pain. Because
because it's worth going out of your way to do something that maybe traditional medicine doesn't like. Because I'm going to just be honest with you, in my opinion, and I've been trained, I did a 2-year fellowship in what's called functional alternative medicine after my residency, at my 4-year residency at UCLA, after 4 years of medical school. So I did an extra 2 years to learn about things that we weren't trained in medical school or residency, because a lot of those things are really the answer, and they're typically natural treatments, is why I like to do that. I like things that are natural, and I would rather do something that's not invasive, something that's conservative. And I have found through the years many, many, many things that have helped people that traditional medicine scoffs at. So I'm going to go to Jerry, if you don't mind, Nita.
Let's do
it.
it.
Just calling about his knees.
Yes.
And knees are always a great subject to talk about because everybody has them. So, Jerry, what's going on? How long have your knees bothered you?
I'm calling because I have to.
Okay.
Anyway, I was wondering, with all the athletes and things like that in, baseball, football, hockey, whatever, why don't they use you instead of getting Tommy John surgery and being out for the whole season?
You asked an amazing, amazing question. And I'm going to use the word political in nature. It costs a lot of money to get a surgery, right?
Well, that and the fact that a pitcher can't pitch for 18 months or whatever it is.
That's right. But let's talk about the money aspect just for a second. I don't want to get into this a lot, but you did ask the question, so I'll respond out of respect to you. The medical system is driven, unfortunately, by money, just like every system on this planet is. Even institutions that we think are totally altruistic still have a money component. So let's say a hospital makes anywhere from $30 to $150,000 on a surgery. Okay? If they didn't have these surgeries, they would go bankrupt. Okay? You talk to any hospital administrator and says, what drives the money in your hospital? They're going to tell you it's the surgeries that come in. So I'm not going to say it's a conspiracy, but they use orthopedic surgeons as their experts, and it's just a big spider web of driving surgery, and the culture drives surgery, and it's the way we were raised that the surgeons were the gods of medicine. Not so much anymore, because if you take a look at Google, you just do a Google search on PRP or stem cells for, let's say, knees or shoulders or whatever, you're going to see that the biggest area of investigation today is in stem cells. And in my book, which I'm showing to the camera right now, is, it's called Stem Cell and Platelet Therapy, and then the byline is regenerate, don't operate. Now, I'm not making this stuff up. This book is all full of studies. Nita, how many studies in this book?
264.
She's right. I'm looking at it right now. This is just a book full of
Dr. Darrow,
studies.
can I interrupt for just a second?
Of course. We love you. Go ahead, Jerry.
I feel loved, believe me. But I'm the general manager of the Dodgers. And the kid with the wild red hair just ruined his elbow and going to go for Tommy John. I'm the general manager. I don't, the hospital can say what they want. They don't own the Dodgers.
You're right, but Jerry, you being the man who's running the show, you tell me, I'm not going to tell you because I know the answer, but you do too. You tell me why your guys don't do this and they get surgeries.
Yeah, well,
You're
think
driving
I would
it.
Try it. Well, I think I would try it if I was a pitcher.
But they don't. They can't. They can't do it. They have to go behind closed doors to do it. I'll be honest with you. I get a lot of pro athletes who come in, and they go, "Please do not talk about me to anybody. You cannot tell my manager. You cannot tell my orthopedic surgeon that I am doing this." Because the orthopedic surgeons are the ones that are driving the surgeries, obviously, and they're the ones who are the, I don't know the right word, but they're the ones managing the injuries, okay? And you know that.
Wow.
I'm not telling you anything new. So most of these guys are just going to get the surgery because they have to.
Yeah, I mean, everybody's got doctors on call and in the dugout or whatever. Well, I don't. Well,
you heard what I had to say.
Things.
I'm not lying to you. I get a lot of pros who say, please, you cannot tell anybody that I'm getting this procedure. I'm paying out of my own pocket.
Wow.
So you and I will have another conversation after the show, because I know that you're a man who cares about people just by you calling in about this. But at the same time, if you really care, you are the one who can do something about it and change the system. And we would love to have you do that. Obviously, we don't like people getting surgeries that don't work, and especially athletes who can't get back to their sport. And especially when you do a surgery like a Tommy John's or anything else, you're disturbing the natural tissue. And they don't need to be done. I've had endless people ready for Tommy John surgeries who have come in and had stem cells or platelets and heal up.
Okay. So many things in life I don't understand. I'll add this to the list.
Well, life is a mystery, but this is one that I think you do understand.
Okay, Dr. Darrow. Thank you.
Thanks for your call, Jerry. Our number...
Jerry, that's okay.
Okay. Our number is 866-870-5752, 866-870-5752.
This, Jerry, if you're still listening, I'm going to tell you a quick little story. One of my very best friends was Joe Weider, who was, we'll call him the father of bodybuilding. He owned all the magazines, Muscle and Fitness and whatnot. And he used to spend a lot of time at my office. We just hang out all the time. We just loved each other. He didn't have a son, and he looked at me as one of his sons. And he always wanted to help me. He used to have photographers come out to my office and do photo shoots with me and famous bodybuilders and put them in his magazines. And he used to always complain, kind of like you are, Jerry, where he'd say, I don't know why these guys have to take steroids. That's the way Joe talked. They shouldn't be taking steroids, testosterone and whatever else they used. And I said, Joe, they take it because of you. And he goes, what do you mean? I said, you're selling the magazines, you're putting them in these magazines, and they are competing for who's the biggest and who's the most cut. You're driving the steroid business. And he goes, my God, I never realized it before. And that's the same thing with the guy who is running the athletes, sending them to surgery. We all got to wake up.
Good
all
point.
of us on the planet have to wake up every day to what we're really doing, because human nature makes us, many things. It makes us greedy, it makes us lazy, it makes us follow rules that shouldn't be followed. I'm going to just say it, I'm a maverick. No one's ever liked me for doing this work except my patients.
Exactly.
The doctors, all three, and especially when I first started, I was the devil. Every doctor in town who did surgery would badmouth me. Time for the break, Nita.
It's time for... You're listening to Living Pain-Free with Dr. Marc Darrow. That's Mark with a C. Please grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.